Hi everybody, this is Beth Gregg from Wyndemere Residential Health Services. I'm going to be doing a presentation for you today about emergency procedures for here at Wyndemere Independent Living. These are the topics that we're going to be talking about in this presentation. We'll be talking about AEDs, otherwise known as defibrillators, CPR, choking, and first aid. So if you're not familiar with what an AED is, otherwise known as a defibrillator, I like to think about it as jumper cables for your car. You know, when your car battery dies, then you get out your jumper cables and connect it to another car, and that car, you restart the battery, and then it kind of charges up your car and gets it to work again. In a way, that's how an AED works. If somebody's heart isn't beating in a correct rhythm, it's not going to pump blood effectively. So that heart actually needs to be stopped, rebooted, kind of like a computer, so it can start again. And that's what an AED does. An AED won't give a charge to somebody who doesn't have a heart rhythm that would benefit from getting that shock. So that's one of the biggest questions I get from people is, could you use the AED wrong? And it actually isn't possible to use it wrong. The machine itself just simply won't let you do it incorrectly. So we're very lucky here at Wyndemere to have so many AEDs on our campus. We have AEDs outside the main dining room on the ground floor by the coat closet. We have one on the first floor by the mailroom, one on the second floor in the hallway by the center elevator, and on the third floor by the library. We don't have to use the defibrillators that often, thank goodness. So when we were looking for the right product to have, we really wanted to find something that was as easy as possible for everybody to use, residents and staff alike. Because the AEDs are not just for the staff to use. We want to make sure that all of our residents, visitors, family members, and our staff know that they can use them, know how to use them. And we wanted to make sure that we found the one that is the simplest to use. So the product that we have here not only will tell you what to do every step of the way by audio instruction, but there's also a video monitor on it. So it shows you little clips of movies and pictures and tells you exactly what to do every step along the way. When you turn on the machine, it starts by telling you, reminding you to call 911 as the first step, which is what we want everybody to do. And then from there, it tells you about taking out the pads, where to find them, how to put them on. And it even goes so far as to talk you through the steps of CompressionOnly CPR, which is something we'll go through shortly. The only thing that you really have to remember, if you forget everything else that we talk about, is how to turn the AED on. And it's very simple. You just look for the green button, you push the green button, and it will turn on and get you started. So just to remind you, how to find the AEDs. You'll find them in a white cabinet that's a little bit projected out from the wall, and there's also a triangular AED sign above the defibrillator. Once you know that they're around, you'll start seeing them, but I recommend that you take a few minutes and make sure that you know where each defibrillator is on each floor, so in the event of an emergency, you know where to go immediately to find one. So again, just as a review, they can be found in the following locations: the ground floor of Wyndemere by the dining room and the coat closet, first floor Wyndemere by the mailroom, second floor Wyndemere by the center elevator and the hallway, and third floor Wyndemere by the center elevator and the library. I want to talk about the steps of compression-only CPR. A lot of people are intimidated by the idea of doing CPR, and in all honesty, it used to be quite a complicated process. But the American Heart Association took a good look at CPR and realized that a lot of the steps that they used to recommend really don't need to be done by a lay person, and they recommend for most people to do compression-only CPR. What does that mean? That just means that you don't have to take that step of doing mouth-to-mouth resuscitation. There are a few reasons why they took this away. The first is nobody really looks forward to doing mouth-to-mouth resuscitation, and they found that people weren't willing to step up and try to do CPR because of that step. So they thought that doing compression only would encourage more people to try to do CPR. But the other thing is, more importantly, is they found that if you do compressions correctly, it actually creates a vacuum in the chest, kind of sucks air in with each compression when you release it. It sucks air into the lungs, so you actually are doing some oxygenation just in doing the compression process. And the third reason is it just makes the whole process a lot smoother, a lot easier to remember. So I really encourage all residents to listen to this, to understand the steps of compression-only CPR, but to really take a look at your own self and to see if you have the physical capabilities to be able to get down on the ground, to be in a kneeling position, to be doing compressions. It is a physical task. I would never want you to be in a position that your own health is at risk. So if you don't feel that you have that ability, that's okay. That's not a problem at all. You can still do the most important step, which is calling 911. So 2 steps to save a life in compression-only CPR. Number 1 is to call 911 right away. No matter what, even if that means leaving that person alone, going to a phone and calling, that is okay to do. Our paramedics are so close by, the sooner we get them here, the better. And the second step to compression-only CPR is to push hard and fast in the center of the chest. So let's pretend that somebody just suddenly goes unresponsive. What would you do? So the first thing you would do is to shake their shoulders and say, "Are you okay?" You want to make sure, if you find somebody that's unresponsive, that they're not just sleeping. So really shake them and see if they're able to respond. Then, if they don't respond, this is when you would go call 911 immediately. So what happens when you call 911? The first question they're going to ask you is, what's the emergency? What you would say is, I need an ambulance at 200 Wyndemere Circle in Wheaton, or wherever it is that you happen to be. And then they'll talk you through some other questions. If you don't know the answer to any of their questions, it's okay to say, I don't know. So don't worry about making a call. They're very supportive about it. If you happen to be on a portable phone or cell phone, you can bring the phone with you over to the person, and they will coach you on the phone how to do CPR while you're waiting for the paramedics to come. So certainly don't hang up the phone until they tell you that it's okay to hang it up. So just keep that in the back of your mind. So after you call 911, if you can, go get an AED and bring it to the site, because remember, it will talk you through all of the different steps of CPR along with using the AED. And if somebody is unresponsive, it could be that an AED might benefit them. So try to get that. If it means sending somebody else that happens to be around to go get it, that's great. That is a really good idea, because then you can start working on the compression-only CPR. Again, if possible, if somebody else is around, ask them to alert the front desk to let them know what's going on. What'll happen is they'll get the paperwork ready for the paramedics to come in, so they have all the emergency information, but they will also dispatch staff to you, so the staff can come over and help manage the situation. So if you're on your own, go ahead and leave that person, call 911. If you can get the defibrillator, great. If there are other people around, ask somebody else to call 911 and come back and let you know that they did. You want to make sure that they actually have called. You can send somebody to go get the defibrillator, and you can send somebody to alert the front desk. So we talked just briefly about compression-only CPR, but we're going to get a little bit more into detail here. How do you actually do it? The person will be lying on their back. You're going to get in a kneeling position by their side, and of course not everybody is going to be able to do this, so this will be something you have to decide on your own, whether you have the physical strength and the capabilities to get down on the ground and to do this. To do compression-only CPR, place the heel of your hand in the middle of the chest, right in between the 2 nipples. Put your other hand on top of the first with your fingers interlaced. And then you're going to compress the chest at a rate of at least 100 pushes per minute. And the way that they help people remember this is think of the song Staying Alive for appropriate speed of compressions. If you know that song, just kind of sing it along and it'll help you do the right rhythm. But again, if you have the AED on site, the AED will actually count out your compressions for you, making it a lot easier to know how quickly to go. Don't forget the AED will instruct you on what to do. All you have to do is press the green button on the AED to turn it on and get started. You're going to compress the chest at least 2 inches, and you're going to allow the chest to completely recoil before the next compression. So you're going in pretty deep, but think about it. You need to get through the rib cage, the sternum, and actually squeeze the heart. And to do it correctly, you do have to go pretty deeply. Some people get concerned about this. They worry about bones breaking. What I just recently learned from a paramedic trainer is that you will hear a lot of pops and cracks. That's not necessarily bones breaking. It's just separating some of the binding materials that hold the ribs together. So don't be concerned if you do feel that or hear that. It is okay, and it means that you're doing compressions correctly. So if you have the AED on site, at some point the AED might tell you to stop touching patients. They're going to analyze their rhythm. And then they might say to press the shock button. So do so after making sure that nobody is touching the patient, including yourself. If a shock is not needed, resume CPR as directed by the AED. Be sure to leave the AED connected because the AED will continue to monitor the victim and will give you further directions. And don't forget, the AED will not let you give a shock if it's not appropriate to do so. At Wyndemere, we have a few people that do not want to have a defibrillator used or do not want to have CPR done in any circumstances. For those people, we have asked them to wear a medic alert bracelet on their left wrist that says DNR as a way to help anybody in the community responding to an emergency know that that person has a do not resuscitate order. So please, if you can, check the left wrist to see if a DNR bracelet is there. If there is a DNR bracelet on the left wrist, do not start CPR and do not use the defibrillator, the AED. Please make sure that the bracelet says DNR because people might be wearing medic alert bracelets for other medical conditions like an allergy or a heart condition or something like that. If you're not sure whether that person has a DNR order or not, go ahead and get started. When the paramedics come on site, they're given a copy of the person's advance directives and they will take over the scene from there, making those decisions. So we're going to talk a little bit about choking now because choking is something that can happen pretty easily to people in our population here. Want to make sure that you know what to do in case somebody that you are eating with suddenly starts choking. So the choking signs, you're going to look for the universal choking sign, which is in that picture there. A lot of times people cross their hands on their neck just to show that something's going on. You'd also notice that person can't breathe, cough, or speak. That person's making high-pitched sounds when breathing. Their lips and their fingernails might become blue. So the steps of choking are shown in this picture here. And first you're going to ask, are you choking? Call 911 if the person can't speak or breathe. Again, that's really important to get that 911 paramedic team out. It's really great if somebody else is around and they can call while you start doing the following procedure. If the person is still awake, you're going to go around behind them, make a fist, place it above the person's belly button, well below the rib cage, pull sharply inward and upward, and continue doing that until the food comes out or the person can breathe. If you are doing this and it's unsuccessful, and the person stops responding and goes unconscious, as you can without hurting yourself, just ease them to the floor. They're going to be lying down on their back. Open the mouth. If food is there, take it out. If food is not visible, tilt the person's head back. Pinch the person's nose, place your mouth over the person's mouth and give 2 breaths, and then start pushing hard repeatedly in the center of the chest for 20 seconds. So basically what you're doing is you're doing compression-only CPR. And what that can do sometimes is to help dislodge that food that's stuck in the esophagus. And then you're just going to keep repeating those compressions until hopefully the food comes out or until the paramedic team comes. They do have here about the rescue breathing. Again, our nursing team, CNA, security team, fitness team, we are trained in CPR. That is one of the steps officially if you're trained in CPR. If you are a lay person and you're not trained in CPR, it's okay to bypass that rescue breathing and just do the compressions. So we'll talk a little bit about first aid. If anybody is interested in getting a first aid manual with the information we're going to be breezing over in the next few slides, please let me know. You can ask for one by calling me, emailing me, or stopping into Residential Health, and I'm happy to give you a copy. So we're not going to go too much into detail on first aid in this presentation, but do let me know that if it looks like an important tool for you to have the first aid manual, I would be happy to give you one. So in the first aid manual, you will see that it includes some common areas of first aid. In this slide, it's showing you burns, what you would do if you had a burn, what you would do if you'd have a severe burn. There's a little bit of a difference between the two. And if you look, you'll see a red box. That red box is your heads up to know that if you are noticing the situations that are in that red box, it's important that you call 911. Obviously, not all burns would require a call to 911, but sometimes in an emergency, it's hard to know which way you should go. So hopefully this guide will give you a little bit of information about when it's important to call 911. And you'll see on this slide, talks about what you can do if you do have a burn, to cool burn, what you can use to protect it, how you can treat the pain, when to see the doctor, and what things maybe you shouldn't do. There are a lot of household tips that sometimes people think are important to do, but they've actually found that it's not a safe thing to do. Under severe burns, obviously that's more of an emergency situation. You would be calling 911 first, and then while you're waiting for 911, those are some tips of what you can do to protect the person while you're waiting for help to come. Nosebleeds are something that happen quite often here. So the guidelines show you, how to stop the bleeding, leading forward instead of tilting your head backwards like a lot of people do, applying pressure, and make sure you really keep the pressure on it for 5 minutes without removing it. And time yourself with a clock, because 5 minutes actually will feel very, very long, but it's important to try to put that pressure on and not keep opening it up to see if bleeding's going on. And then when to call your healthcare provider. Cuts, lacerations, these happen quite often for folks, and sometimes people don't know the steps of what to do. So keep this one nearby for you. Look at when to call 911, but also look at how you should address a minor cut, minor injury, how you can make sure that it's as clean as possible and the bleeding will stop. Dizziness. Dizziness can come from a lot of different reasons. So you notice that there are quite a few times that you would call 911 when it comes to dizziness, but sometimes it just happens for other reasons that aren't emergency reasons. And so this handbook gives you a few suggestions on how to treat the symptoms, when to call your doctor, and how to follow up. Fainting is kind of a branch off of the dizziness. Most times if somebody faints, you should call 911. You should go ahead and get that healthcare practitioner in, or get that person into the hospital. Fainting is not something that is normal and it should not be happening, so it should be addressed. Muscle strains can happen pretty easily. So here are some guidelines about how to control the swelling, prevent further injury with the acronym PRICE: protect, rest, ice, compress, elevate, with some other suggestions along with it. Sprains go along with muscle strains, so they're very similar. We do have a lot of folks that get a sprain for different reasons, so hopefully this information in the handbook will be helpful for you. Splinters. Splinters are rarely, if ever, an emergency, but they can be very painful. They can lead to infection. So here's some guidelines, some suggestions on how you can try to get a splinter out if you do have one. We need to just spend a couple of minutes talking about falls here at Wyndemere for the safety and well-being of our residents. In the case of any fall or situation when a Wyndemere resident is on the ground and cannot get up without assistance, the Wyndemere staff are required to call 911. This is to protect all parties from getting injured. So we have had some instances where people have fallen. They don't feel pain at the time. Adrenaline gets released in an emergency situation, and adrenaline can knock out pain receptors, so somebody doesn't actually feel pain. And we've had folks that have been on the ground who have said that they don't have any pain, and it turns out that they did have a broken hip. And if we had tried to move them, that would have been incredibly damaging. Likewise, if somebody has hit their head and not realized it, we've had some folks that have hit their head and had to go in for emergency brain surgery because of a brain bleed. So we are required to call 911. The paramedics are trained to know what to look for, and they will give guidance on whether a trip to the emergency room is necessary. They will not always recommend a trip to the emergency room. Sometimes they'll simply give you a boost up after checking you over, and that's okay. But if they suggest you go into the emergency room, I would recommend that you take them up on it. They don't do that lightly, and if they're suggesting it, there's a reason that they are. If an employee, vendor, or visitor has fallen and can't get up independently, please follow the same precautions. So again, if you'd like a hard copy of our First Aid and Medical Emergencies Manual, please let me know. I can be found at Residential Health Services on the ground floor of Wyndemere across from the beauty salon. You can call me to ask for one. My phone number is 630-681-4037, or you can email me at gregbeth@windemerelcs.com. Don't forget, Residential Health is here to help you be healthy and safe. If you have concerns or questions about first aid, emergency procedures, or any other questions about your own general health and well-being, please let us know. We're here for you. We're open Monday through Friday from about 7:30 to 3:15. The main phone number to our office is 630-681-4038. We're located at Wyndemere on the garden level across from the beauty salon and the bistro. Thank you so much for your attention to this important information. Let us know if you have any questions, and I hope you have a very healthy and safe year.